Welcome to Medicare School Daily, where we help you understand Medicare, save money, avoid mistakes, and above all else, get the most out of your Medicare benefits. Now, today's topic is what you must know about Medicare Part D mail order. Many of you today that are on employer group plans or maybe individual plans get your prescriptions through the mail, and you like that service. It is very convenient, and sometimes the price is better, so it's more cost-effective on the drugs, and sometimes the plan even makes you go through a mail order service. Now, folks, when you go on Medicare, Medicare will give you the option of using mail order. You'll have options for retail as well as mail order. All right, and so you may decide to use Part D mail order services. However, I want you to realize there will be some distinct differences on Medicare mail order versus your other group plans. And so today I want to really highlight 5 different features of Medicare prescription drug plans when you get your scripts through the mail. Don't assume that your medications are going to be cheaper, because that is not always the case. In fact, some meds will be more. And the reason for that is this: because every plan is going to identify certain pharmacies as preferred and standard. And so we have preferred pharmacies on every plan, and we also have some that are going to be standard. And you and I don't get to decide that. The plan decides that every year. And so there will be usually 2 or 3 different retail options where we have preferred, and the rest will be standard. And preferred just simply means those are the retail pharmacies that are going to give you better pricing. And there are some plans that will give you preferred pricing when you use their mail order service, and others they use the standard pricing, so you actually can even pay more whenever you use the mail order for your prescription. So don't assume that's always going to be cheaper, because such is not always the case. Now, the third feature is this: the plan itself is going to choose the provider. Many times people will say to us, well, I use Express Scripts. Well, it could be that when you go on Medicare that your prescription drug provider doesn't use Express Scripts. They may use OptumRx, or they may have their own mail order service, and so you don't get to decide that. So whatever the plan says will be the mail order provider, that's who you're going to have to get your prescriptions through, and hopefully it'll be someone that offers preferred pricing for you. Okay? And then number 4, quantity limits will apply. Most people, when they're on mail order, they are accustomed to get a 90-day supply of medications. Well, that's not always the case with Medicare, because there are quantity limits. Medicare says with some prescriptions, there can only be so many pills in a bottle. So Medicare may say the most that can be in that bottle when they send it to you is 60 pills. So if I'm taking 2 a day, that's a 30-day supply. If I'm taking 1 a day, that's going to be a 60-day supply. And so many times Medicare will put quantity limits on medications that are either addictive or very expensive. And so don't assume you're going to get necessarily a 3-month supply, because that's not always the case. And then the 5th feature that is different with Medicare plans is this: Part D plans can be changed annually. Medicare has on an annual basis what we call the open enrollment period. And this open enrollment period is from October the 15th through December the 7th. And so we have these 7 weeks every year where people are able to change drug plans when necessary. And so if you change drug plans, it could be that when you change plans, the mail order service is also going to change. All right. And so they'll send you a packet of information, and in that packet, they will identify what mail order service or services that are available for you. And they will tell you how you can get your prescriptions to that mail order service. So if we switch plans, we may need to get our prescriptions resent into the new mail order service. And so you're going to have to live with that as well. All right. Now listen, only about 15% of all people have to change their drug plan on an annual basis. But if it ever happens to be you, then the mail order service may need to be changed as well. All right. So those are the 5 distinct features with Medicare prescription drug plans that you need to know about if you decide to use mail order for your Medicare prescriptions. To learn more, watch the related video or check out our most recent video. Also, be sure you click to subscribe for free and get notified every time we post a new video. To watch our complete Medicare workshop, go to MedicareSchool.com. And finally, when you're ready to compare all your insurance options and get free enrollment help from one of our Medicare School guides, call the number on the screen. See you next time.